Have you ever wondered why some medications can't be mixed? What happens when they do? Well, that's what we're here to explore. The world of prescription incompatibilities is a fascinating and complex one, and it's an essential part of understanding how our bodies react to different medications. Prescription incompatibilities occur when two or more drugs interact in a way that can be harmful. This is not a simple case of 1 + 1 = 2. The interplay of different medications can create unexpected and sometimes dangerous results. There are three main types of prescription incompatibilities to consider: physical, chemical, and therapeutic. Each of these categories provides a unique lens through which to view and understand drug interactions. Physical incompatibilities focus on the physical state of the drugs, while chemical incompatibilities concern the chemical reactions between drugs. Therapeutic incompatibilities, on the other hand, deal with the effects of drugs on the body. Let's delve deeper into these types of incompatibilities. Physical incompatibilities occur when two substances can't mix physically. But how does this happen? Picture this. You're trying to mix oil and water. No matter how much you stir, shake, or blend, these two just won't become one. This, in essence, is a perfect example of a physical incompatibility. Let's dive deeper into this concept using a real-life case study. Consider a person prescribed with two medications. One is oil-based, while the other is water-based. These two drugs, when taken together, won't mix well in the body, much like oil and water in a glass. The oil-based drug might form a separate layer, preventing the water-based drug from being absorbed properly. This separation is a physical incompatibility, and it could lead to decreased effectiveness of one or both medications. But why is this a problem? The answer lies in the potential dangers of physical incompatibilities. When medications are not absorbed as intended, it can result in suboptimal treatment outcomes. In other words, the patient might not get the full therapeutic benefit of the medication, or worse, it could lead to unforeseen side effects. For instance, if a water-based drug designed to control blood pressure isn't absorbed correctly due to a concurrent oil-based medication, it could result in uncontrolled high blood pressure. This could potentially escalate into serious health complications, such as stroke or heart attack. Physical incompatibilities are not just limited to oil and water scenarios. They can also occur due to differences in pH, temperature, or even texture. For example, a medication that needs to be stored at a cool temperature may not work well with one that requires a warm environment. Similarly, a drug that is solid may not mix well with a liquid one. In summary, physical incompatibilities are a critical aspect of prescription drugs that can affect their efficacy and safety. They occur when two substances cannot mix due to their physical properties, and can lead to decreased effectiveness or increased side effects. It's important to understand and navigate these incompatibilities to ensure optimal patient care. Physical incompatibilities can be dangerous, but they are not the only type to be aware of. Next, we have chemical incompatibilities. These happen when two substances react chemically. Sounds explosive, doesn't it? Dive into the world of chemical reactions, where certain medications can behave like a volatile chemistry experiment. Imagine a scenario where an individual is prescribed two different medications, say drug A and drug B. Drug A is a lifesaver for a specific condition, and so is drug B for another. But the real drama unfolds when these two drugs meet inside the body. In the case of a chemical incompatibility, drug A and drug B, instead of working individually on their respective tasks, decide to interact. This interaction is not a friendly handshake, but more like a wrestling match. They undergo a chemical reaction, leading to the formation of a new substance. Let's call it Substance X. Now, Substance X wasn't invited to this party. It's an uninvited guest. That could potentially wreak havoc. This havoc could range from reduced effectiveness of the original drugs to harmful side effects. For instance, the new substance might not be as effective as drug A or drug B in treating the conditions they were meant to. Worse yet, Substance X could have harmful side effects that neither drug A nor drug B would have caused on their own. This is exactly what happened in a reported case where a patient was prescribed both an antibiotic and an anticoagulant. The interaction between the two drugs led to a decrease in the effectiveness of the anticoagulant, putting the patient at risk of blood clots. So, chemical incompatibilities are no laughing matter. They underscore the importance of a holistic approach in prescription, where the compatibility of medications is as critical as their individual effectiveness. But don't let this scare you away. The world of medicine has developed strategies to tackle these chemical incompatibilities, ensuring that the drugs you take are not only effective, but also compatible with each other. Chemical incompatibilities can be harmful, but there's one more type we need to discuss. Lastly, we have therapeutic incompatibilities. These occur when two drugs interfere with each other's therapeutic effects. Imagine this scenario. A patient is prescribed a blood thinner to prevent clot formation and a non-steroidal anti-inflammatory drug to manage pain. These two medications, when taken together, can lead to a therapeutic incompatibility resulting in increased risk of bleeding. This is because the blood thinner is meant to prevent blood clots, while the anti-inflammatory drug can inhibit platelet function, which is crucial for clotting. The combination of the two can lead to an amplified effect, causing an increased risk of bleeding, a situation that could be dangerous or even fatal. Such incompatibilities are not limited to these two drugs. There are myriad combinations of medications that can lead to therapeutic incompatibilities. For example, combining an antihypertensive and a non-prescription decongestant can result in the reduction of the antihypertensive's effectiveness, potentially leading to uncontrolled high blood pressure. In another case, an antibiotic might interfere with the effectiveness of a contraceptive pill, potentially leading to an unwanted pregnancy. These examples underline the potential risks and dangers of therapeutic incompatibilities. They can lead to reduced treatment effectiveness, increased side effects, and in some extreme cases, life-threatening conditions. But it's not all doom and gloom. It's important to remember that therapeutic incompatibilities can be prevented. The key is effective communication between the patient and healthcare providers. Patients should always inform their doctors and pharmacists about all the medications they are currently taking, including over-the-counter drugs, supplements, and herbal products. Healthcare providers, on the other hand, have the responsibility to review all the medications a patient is taking and assess potential incompatibilities. They should also educate patients about the importance of not self-medicating or altering their medication regimen without professional advice. Incompatibilities can pose serious risks, but there are ways to prevent them. So, it's crucial to stay informed and vigilant about the medications we take and their potential interactions. So, how can we prevent these incompatibilities? An excellent question, and one that we will be addressing in this segment. Incompatibilities in prescriptions can be prevented using various methods, and key players in this process include physicians, pharmacists, and of course, you, the patient. Physicians play a crucial role in preventing incompatibilities. By carefully reviewing a patient's medical history, current medications, and potential allergies, physicians can minimize the risk of prescribing incompatible medications. They also need to consider the patient's age, lifestyle, and any existing medical conditions when prescribing, as these factors can contribute to incompatibilities. Pharmacists, on the other hand, serve as the last line of defense against prescription incompatibilities. They are responsible for double-checking prescriptions, ensuring they are free from errors and potential incompatibilities. Pharmacists also provide valuable advice to patients about how to properly take their medications, which can help prevent therapeutic incompatibilities. However, the role of the patient should not be underestimated. Patient education is key in preventing incompatibilities. As patients, we need to be proactive in learning about our medications, understanding their side effects, and knowing how they interact with other substances. We should always follow the prescribed regimens, take medications at the correct times, and avoid any substances that could interact negatively with our medications. Moreover, open communication between the patient, physician, and pharmacist is vital. If you're a patient, do not hesitate to ask questions about your medication and express any concerns you may have. Remember, it's your health on the line. Lastly, technology can also aid in preventing incompatibilities. Electronic health records and prescription software can flag potential incompatibilities, helping health professionals catch them before they become a problem. So, in summary, Preventing incompatibilities requires a team effort. It involves the physicians, pharmacists, and patients working together, supported by technology, to ensure that the prescribed medications are safe and effective. By being vigilant and well-informed, we can avoid the dangers of prescription incompatibilities. So, let's be proactive in our healthcare and strive for safe and effective medication use. Incompatibilities in prescriptions can pose serious risks, but with knowledge and vigilance, we can prevent them. Today, we've delved into the three main types of incompatibilities: physical, chemical, and therapeutic. Physical incompatibilities, like precipitate formation, can impair drug effectiveness. Chemical incompatibilities may lead to hazardous reactions or change a drug's properties. Therapeutic incompatibilities occur when two drugs interfere with each other's actions, potentially leading to harmful effects. But it's not all doom and gloom. We've also explored various methods to remove these incompatibilities, from careful drug selection to precise timing of administration. These strategies underline the crucial role that healthcare professionals play in safeguarding patient health. Understanding prescription incompatibilities is key to preventing adverse drug reactions. And remember, whether you're a healthcare professional, a student, or just an interested individual, staying informed is a vital part of that process. Remember, knowledge is power when it comes to your health. Subscribe for more.